Welcome back, everyone. We're at the Emids 2021 Healthcare Summit. We are virtual for our panels again this year. I'm very excited, hopefully next year, to be back live. But we are back virtual here in 2021 and have a very exciting panel topic today. I'm Russ Thomas. I'm your moderator. I'm the Chief Executive Officer at Availity. We'll allow our panelists to introduce each other just in a moment. But first, the topic of our panel. So we are panel 2 today, the topic of which is hybrid isn't just a solution for cars. We've lived through these very interesting times over the last several years. We're now coming out of the pandemic in this post-pandemic world, and we've seen some very exciting healthcare solutions evolve during this pandemic. A lot of virtual, a lot of providing real world access to care through means that we had probably never considered in a lot of ways, both in terms of traditional care as well as social, emotional, mental, and physical care. So today we have a great set of panelists who have all lived through it, run their businesses through this pandemic, and have some great insights to share with us on what does the future look like, right? What kind of solutions can we expect? How do we expect healthcare to evolve in this post-pandemic world? And particularly, how are we going to leverage hybrid systems of care and hybrid models of care to, again, ensure that we've got a better, higher quality, transparent, affordable healthcare system. So with that in mind, I'm going to ask our panelists to introduce themselves to us. We'll start with Richard Ashworth. Richard, do you want to give a quick introduction?
Yeah, thank you. So Richard Ashworth, I'm the president and CEO of Tivity Health. We bring the brand Silver Sneakers, Prime, and Whole Health Living to the market to help senior beneficiaries.
Awesome. Thanks, Richard. Kate, thanks for joining us. Kate Ryder this morning. You want to tell us a little bit about yourself?
Thanks, Russ. I'm Kate Ryder. I'm the founder and CEO of Maven. So I started Maven 7 years ago to really transform, the healthcare system for women and families, and to put them and their needs at the center. And so today, Maven is a virtual first care platform, really serving the family building and maternity and pediatrics journeys. I'm working with both employers and health plans to deliver better solutions.
That's awesome. Thanks, Kate. And certainly last but not least, Brad Smith. Brad, do you want to introduce yourself, please?
Sure. Brad Smith. Last year I was up in DC running CMMI, but actually ended up spending most of my time at the White House working on COVID. And then this year moved back to Nashville, where I'm from, where I've gotten involved with 2 companies, one called CareBridge Health that takes full cap risk on home and community-based service patients, where I'm executive chair. And then another one that we just started called Main Street Health that I'm actually running day to day. It takes full cap risk on rural primary care patients.
Awesome. Well, thanks for joining us. So let's jump right in. And what I'd ask you to do is let's have a conversation with each other. And I'd love to hear both sort of your real world experiences as well as how your companies, Brad, in your case, your portfolio companies, Richard and Kate, the companies that you run are adapting to this new world that we're in. So we'll start with one of the topics that is how can health systems best design and scale a hybrid care model that provides consistent experience and triages patients appropriately, whether they are being referred to in person or whether they're being referred to from a virtual perspective. So love to get your perspectives on that. Richard, maybe you want to kick us off with your thoughts on that.
Yeah, I mean, it's a huge topic right now. Obviously, with COVID, we've had this acceleration or exacerbation of people needing to consume experiences digitally. I think one of the big things that we find is that a lot of companies are trying to, instead of incorporate digital or virtual into their customer experience or into their clinical pathways, they kind of try and just put it on top. And I think that's one of the kind of mistakes a lot of companies are making. So it's almost like a separate experience that isn't connected to your existing business processes. It's always harder to kind of undo what you already have to engage differently. But I think you have an opportunity not only for better experience, but for efficiency. So that kind of back office interoperability is not as much fun, not as exciting for the user experience, but I think really important to get that connectivity so that the visibility for the provider, the visibility for the administrator is right. I think we're also very focused on the clinical side, which is good, and making sure that the records are available and that we have kind of a full 360 view. I think there needs to be a really strong focus on the service side. And so what I mean by that is creating experiences that are in the flow of patients' lives. So the way they live their own lives today. It seems like when you engage and consume healthcare, you're like stepping back in time all the time, and kind of doing it how we used to do it. And I'll finish with this, is that, Activity Health, what we do through Silver Sneakers is we help people 65 plus, primarily through Medicare Advantage, help them get access to gyms, help them get access to healthy lifestyle behaviors like social engagement, mental enrichment, and physical activity. Well, when COVID hit and all the gyms had to be temporarily closed due to all the restrictions, we created a digital experience for these members to consume physical activity, but in their own home. And so this mindset that maybe seniors aren't as adaptable or maybe not as willing to engage in technology is just plain wrong. Over half of our beneficiaries have engaged in medical appointments through video conferencing since COVID has been here. So I think it's a big opportunity to tap into all, groups, not just maybe younger or those that are middle-aged, but our seniors are ready to engage in digital as well.
Yeah. So Richard, I'm curious. I want to follow on to that comment, those comments you just made, and Kate and Brad jump in as well, because I think you're exactly right that the models of care delivery are evolving quickly. Our business, we're very deeply engaged in driving collaboration between providers and health plans, right? That's what we do. You saw in my profile, right? We transact literally billions of times a year between providers and health plans, and just sort of curious on your perspective, your guys' perspective on whether you think the financial models, the business models, are adapting to support that virtual, real-time engagement models that you're describing, because ultimately we're all in businesses, and if you're providing these new types of services for your seniors, and in Kate's case for women's health, do you feel that the underlying financial model is adapting at the right pace to support what you're trying to do?
Sure, I can start to kind of take some of that. So as we think about health systems, I think one point that's really important to think about as you think about designing this new hybrid model and bringing in payment reform to that is childbirth is actually the #1 reason for hospitalization in the United States. And about $1 out of $4 that hospitals make are actually made in labor and delivery and in women's health. And so I think one of the biggest things we see is you have that reality, and yet 50% of US counties don't have an OBGYN. And you see major things like maternal health, mental health not actually embedded in the care model and in the payment model today. And yet 1 out of 4 or 1 out of 5 women suffer from postpartum depression, perinatal anxiety during an episode, which could exacerbate and create adverse outcomes. We have the highest rate of maternal death in the developed world, and 60% of those deaths are avoidable. And a lot of it either happens kind of in that, during labor and delivery, but a lot of it also happens kind of in the postpartum discharge. And so there is just, at least where we sit, so many gaps in the care model. I mean, regardless of this even virtual and bricks and mortar, are the patient that we really, pay attention to, women, children, families, they've not been served at all in the first place. And so I think the way we see it is there's an amazing opportunity here in this new world where people are finally talking about how to innovate on care models, how to innovate with financial, new financial models, to actually bring a whole new care model to women's and family health, where you're really actually focused on, big areas like prevention of premature birth and going into the NICU. You're focused on prevention of C-section. You're focused on mental health and a lot of these, factors that create some of these bad outcomes. And then bringing postpartum care, which is actually not in any of the payment models today, into the experience, because you still are seeing a lot of really negative clinical outcomes right after that. And so right after a birth. And so I think for us, we really look at, virtual models as a way to bring it all together, but in a way where it's affordable, right? Like healthcare costs are rising still in this country. And so, the promise of technology is to actually bring better care to patients, put the patient at the center, but actually reduce costs. And so I think what we see is there are really interesting financial models where health plans and providers can take risk together on the maternity episode and come up with new kind of bundled payments for maternity, where, if you bring virtual into that, you can actually, and you actually really rethink how often people need to go into a hospital, into a prenatal setting, which is very expensive. What can they do at home? What can remote patient monitoring do? How can you bring in, breastfeeding support, culturally competent care to build that trust between providers and patients, mental health, and then, at the end, create a better outcome for everybody. So we're really excited based on the vantage point we sit at as to what you can actually do in this new hybrid model. I think you need the innovators inside the systems to believe it's possible to take the risk.
So sounds like you're very bullish, right? That there is the right level of collaboration, or at least, moving in the direction of the right level of collaboration between, to me, there's three stakeholders, right? The health plan and the provider, both of whom ultimately serve the patient. And it sounds like you're fairly bullish that we're making progress against new models that can support a better patient experience and better outcomes.
Yeah, I mean, we've just been working in a backwater for so long that you can only go up from here.
Oh, that's a great point.
Russ, I think one thing, and it'd be good to get Brad's view because of time at CMI. I mean, there was a lot of good innovation coming out of there and allowing companies. The Chronic Act was great. That opened up a bunch of new benefit offerings under Medicare Advantage, but it still allowed new offerings, and a lot of those are coming digitally. Just one point I want to make on your specific question around, the remuneration and kind of the financial arrangements. I view it kind of like short and medium and long term. I think in short term through COVID, there's been a lot of relaxation and a lot of support to say, hey, just keep care going, right? Like try and help people. I think in the medium term, you're going to start to have this value equation, right? So like what kind of experience and value, which is the intersection of price and experience, right? Am I getting out of this digital experience? And I think that's really important for providers and administrators and all payer service organizations and everyone else, is to not, I hate to say it this way, but just don't go low on it. Like invest behind it. It is here, and long term, it's absolutely going to work. Like we all kind of know it. Everybody kind of nods. But being a chief executive of a company and having fiduciary responsibilities and other things, you're like, how much money can I put toward this? My advice would be to lean forward, because I think the value equation around digital as a supplement, like what Kate was saying, I mean, digital can bring OBGYN providers to homes all across America in rural environments, people where they don't have access. In some ways, right? And I think that's a massive opportunity for the value equation. But in the short term, what I would say is Medicare plans have been very, very supportive of making sure that the reimbursement models for virtual are sufficient for the business, side of it to work. But I'd be interested in other views.
Yeah, no, I agree with a lot of that. I mean, the way I kind of think about it is in two buckets, right? You have businesses that are in kind of full cap risk or some kind of value-based arrangement. And I think within those buckets, really it's about, Richard, what you said early on, which is about how do you integrate it appropriately into the patient experience, because you are aligned with the payer, or you are aligned with CMS or whoever it is that's kind of put you in that risk arrangement. And it's really figuring out, what makes sense for the patient, how will they engage, how do they prefer to engage, what's effective. I think on the fee for service side, what you said is right. People are leaning in. Obviously during COVID, the federal government eased a lot of the regulations around telehealth. And what I believed would happen when I was there is that there would be kind of this big analysis at the back end around, hey, is the utilization that's getting driven a replacement for existing utilization, or is it net new utilization? And I think what you actually see is the federal government's actually going ahead and pushing forward before that analysis has occurred, right? And saying, hey, we're actually going to make, even like a week or two ago, several of these things permanent, especially in the mental health space. And so that doesn't mean that kind of this, is it a replacement or is it net new analysis won't eventually happen. I think it will happen around some of these virtual services, but I think it's actually getting pushed farther out, and people are leaning in even more than I suspected they would when I was up in DC.
So you raised an interesting point there, Brad. and you've seen it from both sides, right? Both from the government side and the commercial side. As an investor, as an operator, I mean, you got a fairly unique perspective here. Is it a replacement, or is it additional, net new engagement, or
Well,
maybe
I
some
think what
combination?
was Yeah, I mean, I think what was so easy during COVID was it was clearly a lot of replacement, right? You saw the volume just declining so dramatically that it was really, you couldn't know if it was all of it, but it was definitely the vast majority of it was straightforward replacement. I think as we come out and as the volumes come back up in inpatient and outpatient, professional settings, et cetera, the
Yeah.
question of how much is it replacement versus not. And I think, but what we found is that there is such demand both from providers and consumers, Medicare beneficiaries, to be able to keep these services they've gotten used to. I do think the cost question is getting pushed out a little bit farther. I would have thought it would have happened now as you're deciding what do you keep and what do you not. But I think there's enough kind of momentum behind it that more things are getting kept than maybe I thought would have gotten kept because there is so much demand and interest in it.
Yeah. I mean,
Yeah,
go ahead, Kate. I'm sorry, please.
Oh, I would just say, from a cost perspective, that's true. But one of the things we're seeing, so we operate the largest women's and family health telemedicine network in the country, with over 30 different types of providers across 350 subspecialists, 2,000 providers. And I think that one of the greatest things that came out of COVID was this interstate operability as it related to licenses, because there is a labor shortage in healthcare workers right now. And I mean, even in our category, 7 million people live in maternity care deserts. So we need more care, through telemedicine across the country. And I think we unfortunately are actually seeing some of that come back, where, it's still just as hard to operate across state lines, and there's not that interstate licensure compact. There's not as much progress as I think we would have liked to see, because so that's, I think, one opportunity that we still need to work out, because, we still see some of our patients, even if they live in New York and they want to see, a genetic counselor or a licensed provider in Pennsylvania, and they can drive 20 minutes and sit on the side of a highway and then be legally allowed to see them. That makes no sense, particularly. So I think there's still definitely some work to do there.
This is great. Let's move on. Let's go a little bit deeper, right? Because all of this is sort of premised upon the tech. At least a lot of it is premised upon tech. I'm fundamentally a believer that tech is not the solution. Tech enables solutions. But let's talk about digital, a word that candidly, from my perspective, gets beat around way too much. I have my own views on what digital means, but I'd love to hear from you guys, sort of your perspective on how is digital being incorporated into your businesses? How is it, Kate, that's a great example. I mean, what a silly thing that somebody have to drive. It's just ridiculous, right? You have to drive 20 minutes and suddenly you're legal to see a provider in New York because you cross the state line. With all that in mind, how are you leveraging digital, Richard, to your point, how are you leaning in to invest in digital solutions to grow your business, both top line and as well as to drive profitability in your business and better experience for your customers?
I think about it this way. I think, to your point, what is digital? We can maybe just put that aside for a second and say it's generally anything that's like virtual technology engaging and not live, maybe in the same room. And for me, it's just about expansion. It's about being able to get to different people than you used to be able to get to. And it's about bringing them, access to care that they inordinately would not have been able to get access to. I agree with Brad exactly, which was early on, this was all about replacement. But in the future, it won't be that. It'll be a little bit of both. I think it'll be expansion and it will be replacement. Replacement for the sense of efficiency, for the sense of broadening, access. I think it's really important for the older population. So everybody always says, well, the older folks don't know technology, they won't engage with it. Not true. They're all Facebook users. They all FaceTime with their kids and their grandkids. Over 70%, and we do a ton of surveys with our 18 million Medicare Advantage lives, and they are telling us 70% of them are using video calls or live streaming to connect with their friends and family. 60% of them use it for other kinds of events, and over 50%, as I said earlier, for medical appointments. So technology is definitely available for them. I think one thing we need to think about in terms of the access to care and what impact it's having is that the support of virtual, it overcomes a lot of barriers. So in our population specifically, there's a big barrier, which is just simply transportation. A lot of our members can't drive. So how do they get to the doctor's office? How do they get to the hospital? It's really, really challenging for them. And the virtual solution almost overnight opens it up. One last point for me is, there are big challenges all across the United States in maximizing virtual or digital care. And one of that is just access to the internet or high bandwidth internet.
Yeah.
Before we started the panel, we're all testing our bandwidth and making sure we can have a good panel. And there are people that are, in parts of this country don't have access to the internet at all. And then lastly is, it's not about one entity kind of like solving the problem. It's definitely about partnership. So public-private partnerships, companies coming together and getting into, whether it be rural areas or low-income areas or lower socioeconomic groups, that they just don't have the same advantages. And so what we'll have is, in the future, if we're not careful, we'll have another replicant copy of our existing healthcare system that is digital and virtual, that still disadvantages those that don't have money or in areas that don't have access. And that would be a shame.
Yeah. That's going back to really what Kate was talking about as well, right? That, that term Kate used, deserts, what was the
maternity deserts?
Yeah, maternity deserts is just horrifying to hear you describe it as that. And are you able to bring, and you talked about this a bit already, but maybe a little deeper, how effectively you're able to bring digital technologies to bear to, bring rain to those maternity deserts that you're talking about?
Yeah, so I think, to be honest, that's the easy part. The hard part there is the broadband access, right? So making sure, and that's something that I think that the government, I wish we could solve that as a technology company, but I think that the easy part is to bring the access through telemedicine. We do that today. I think that what's been really great to see is, we really pay attention to that trust that has been lost in the existing system between the patient and provider, and how to bring that back through virtual care. And so 40% of our providers identify as BIPOC, 10% identify as LGBTQ. And so we're able to actually care match a Black patient and a Black provider, and really actually unlock, I think, that trust, that if they are, for instance, on a Medicaid plan, and the type, they only have access to one provider in their town, who may be a white man who can't even see them for 2 months, and because of that's the only Medicaid credential provider in their town, and they can actually see someone on Maven, within a day, who looks like them and shares their lived experience and can connect with them. So that is one part of like digital that is, I think, incredibly exciting, and how we can bring that better care and better access, particularly to underserved communities who have been left out of a lot of these kind of core healthcare experiences. I think the second thing that's just really exciting, though, is the personalization that you can bring through the data and the technologies that you have. And so, for us, our vision is, a first-time mom living in, San Francisco, who works at Google, is going to have one experience on Maven through the actual digital experiences that she has on the app, but then also the providers that she's seeing. But then equally, a woman who is a third-time mom living in rural Arkansas, who's on a Medicaid plan, she's going to also have a set of experiences and a set of providers virtually that that she can really connect to, and that really meet her needs. And so, and you might have more kind of social determinants elements in that product, whereas the first time mom in San Francisco might have doula access and childcare, backup childcare access, where the woman in rural Arkansas gets transport access and group chats with other people like her. And so there's so much that you can do. And I think someone, it was Richard, you said that sometimes being in the healthcare system, it's like you're 20 years behind. But hopefully, I think what we're seeing is, which is a silver lining, is there's a lot of great innovators now inside of the plans and inside of the health systems and inside of the government that are waking up to actually the promise of this and how quickly it can actually happen. It is not like a 10-year vision. And so I think that there's, I think it just requires that, that the big bureaucracies inside some of these larger healthcare organizations to just move a little bit faster to keep up with how much you can possibly do. Because every day people are having bad experiences and bad outcomes in healthcare. And so every day is a lost day in changing some of this.
So Brad, that's great, Kate. Brad, let me turn to you for a second. So Richard and Kate aren't the seasoned, successful CEOs with great businesses that you see in front of you today. They're young. Well, they're young already, but they're even younger. They're 20-something young entrepreneurs at the Emids conference live next year, and they come to you looking for you to help incubate and start their businesses. How do you think about investing in digital and sort of sorting the great opportunities from the science projects, and by the way, it's relevant, I think, to Richard and Kate and I as well, because we're all in budget season, right? Getting ready for doing our 2022 planning. And I don't know about the rest of you, but the first cut at our budget was off the charts high in terms of investment that our team wanted. And just be curious, Brad, your perspective on sort of how you think about it from an investment perspective and what you're looking for.
Yeah, well, I'd say, everything that we're doing in terms of businesses are all full cap risk businesses. And so, each of those typically serves a very specific patient population. So when we think about the digital versus in person, the question is, what's the best way to serve this patient population? And I think a lot of what Richard said about it has to be in the patient workflow is really important. So I'll give you two examples. So one of our companies, CareBridge Health, takes full cap risk on home and community-based service patients. These are physically or intellectually disabled patients who typically Medicaid's paying for a caregiver to come to their house for 2 hours to 24 hours a day. So in that business, what we do is we deploy a tablet to the home that the caregivers under a federal law are required to use to check in or check out for fraud, waste, and abuse purposes. But then we ask them a number of other questions about the patient's condition. And so as part of that workflow that they already were required to do, they're now doing kind of a value-added type service, and there's a way for them to press this button, or we can reach out to them through the tablet, and they can do visits with nurse practitioners. So they're facilitated in home with the caregiver. And that's just one example of how leveraging that unique way that the caregiver already works in the home, you can do more with virtual. A second example would be in our rural health business, Main Street. We're partnered with PCPs and with independent pharmacies. And it was really interesting. We went out to these focus groups, and the first thing you saw was everybody put their, and these were all seniors, put their cell phone on the table, right? And so, to some of Richard's points, people have definitely, gotten used to, everybody has a phone, most everybody has a phone, people are using that. What was really interesting though, is we created what we thought was a really cool app, and literally nobody used it. And so what we learned is that, in rural America, trust is so important. And so what we're doing now that's working really well is essentially facilitated telehealth. And so when folks are coming into their PCP or into their pharmacy, we have community health workers in the clinic who are then able to sit down, get somebody on an iPad, get somebody on a laptop, and they're more than happy to talk to the nurse practitioner or the physician or the pharmacist virtually. But without that facilitation, at least in the first engagement, in the specific setting, specific demographic we're doing, it wouldn't work. So I think a lot of this is about meeting people where they are. And even if they, are willing to FaceTime with their grandkids on their phone, that doesn't necessarily mean they'll engage with their healthcare provider that way. But I think there are ways to engage different populations in ways that are, consistent with the way they're used to receiving care.
Hybrid, right? I mean, really what you're describing is the ultimate hybrid model, that you have to do some work on the front end to drive adoption and utilization of digital tools, with the belief, back to my sort of how do you justify the expense, because these are not inexpensive things to invest in, a belief that ultimately that can help you drive scale and ultimately a better profitability in your business than if you just had people on the phones with those constituents all day long.
I think that's right. I think you're going to have a demographic, right, who's willing to go pretty digital and pretty virtual pretty quickly. And, the younger, more commercial that is, that the larger that demographic is going to be, then the more you're in Medicare, right? There might be different opinions on how much in Medicare, right? But there's going to be some variation. And then I think the question is, how can you use these hybrid models to move, not those hesitant folks, but those folks who, need it to be more integrated along. And I think the more you're in a Medicare population, to some extent, you're in a Medicaid population, these kind of hybrid models are going to be, even more important for folks that are either not as used to technology or just more distrustful of the system writ large. Although sometimes virtual can be helpful for addressing that, as Kate pointed out.
So let's move on to the next topic. I think it's very related, and Richard, maybe start with you on this one, because there was a fair amount, I think, of before COVID, there was a fair amount of sort of fear, uncertainty, and dread that the virtual model would overtake brick and mortar and would be detrimental to, sort of traditional care models. Obviously, COVID changed all of that, right? Those models, from what we saw, and we sort of sit in an interesting place because we're real time. We have this real time picture of utilization that is sort of unprecedented, right? Because we see the claims, we see the eligibility checks. We know everyone that's going to a health provider. In real time, we certainly saw 35, 40, 45% deterioration in sort of traditional utilization between March and May, of last year. And then candidly, those volumes they quickly came back. By August, we were running into the 90%. And from, September forward, we've been north of 100% of volumes that we saw pre-COVID, which anecdotally, I think sort of leads me to believe that the traditional models are continuing to thrive. Utilizations continue to thrive there, but there is just this sort of concept that, it's back to that: is this net new or is it replacement? Particularly in your population, I think, what's your view on how these hybrid models and the virtual models are going to impact the traditional brick and mortar kinds of models? Are they net positive for those models and those providers are finding a way to leverage digital, or is it Amazon replacing your local community store?
Yeah, I think it's synergistic for sure. I spent 30 years at Walgreens before I came to Tivity Health, and they just announced in the last couple of weeks, right, a deal with VillageMD to kind of accelerate co-location of full at-risk primary value-based care in with pharmacy. And there's a whole digital layer that Walgreens has been building with Find Care and all these other attributes. I find all of that to just be building on one another. So I think it's synergistic. It's also, and the most beautiful part of it is it makes it more holistic. And I think that's a big miss. We have a great symptom care health system here, but we're not focused on the social determinants. Yeah. We're not in front of healthcare. That's why I'm a pharmacist by training, right? So I spent my whole life helping people. And when I got them to help them, there was something fairly wrong. And so I wanted to jump on the front end and see if we can help, especially seniors, prevent them getting to a spot where they need diabetes medicine, or they need high blood pressure, or they need weight loss, or whatever it might be. And so what we've seen is, and just to give a point on the synergistic part of it, we were offering nutrition, and we partnered with Humana to give millions of meals to people, especially when COVID first hit. It was all, pretty stressful. Now our meal platform is one on behavior. It's one on education. It's upfront, and it's trying to just get people to make better choices when they still do go to the grocery store. Well, one other example, think about this. Where were we 2 years ago in home delivery? Put Amazon aside, that's always been their business model. But look at all the other retailers. It's buy online, pick up in store, buy online, ship to the house. Even Taco Bell delivers. So everybody's delivering. And, we partnered with a company called Get Set Up. That's a virtual learning platform. It's like a mental enrichment platform for seniors. So people go and they can teach others to learn new things even later in life. The enthusiasm we're getting for this kind of engagement is off the charts. And so, but to the same point, we have a robust network of gyms. We used to have about 16,000 participating locations that people could go into the gym to work out. And with COVID, it's still, the recovery is here, but they're definitely coming back. Well, we just added now 6,000 more gyms. So now we're at 22,000. It's a great example where you have to do both. So it's not going to be all digital. I think Brad made this point. It's not all going to be traditional. I think they're synergistic together. And there's one last point. Brick and mortar is more expensive. It requires a lot of capital. It requires a lot of infrastructure, people, trucks, all kinds of stuff. And digital is by nature, more inexpensive, but yet you can still get the same, bang for their buck. I think you can't replace all traditional with digital. And I think that would be a fallacy that people were trying to get to. I think it's about both.
Do you think, and this for all of you, one of my favorite smart people is Dr. Larry Van Horn there at Vanderbilt. I'm sure you guys know Larry. Brad, you probably run into him. I'm sure we'll see him at Emids. And Larry does this great discussion on supply side versus demand side healthcare system. And his big pitch is, we've lived in this supply side system forever, and if we've got to make the pivot to a demand based healthcare system to ever drive higher quality, lower cost, transparency, all that sort of stuff. I'm just curious on your perspective, right? We got 5 minutes or so left. Is COVID an accelerator, and digital the means by which we start to move at a higher, faster rate to a true demand-driven healthcare system? And you made me think about that, Richard, when you're talking about the delivery models, right? Because as a parent of 2 college kids, I see the charges for everything from Uber Eats to Amazon to my kids are very, very good at being delivered to, as it turns out. And I think it's a very interesting point. We'd love to get your perspective on on that question.
I'll start. I got one quick point on that. I think, and it's a changing shift, but my kids are a little younger than yours, and so anytime there's a question in the household, it's a hey Alexa, hey Siri, right? Or it's a YouTube consumption. It's all video. It's content delivery. They don't have any, Encyclopedia Britannicas at our house, right? Like when I grew up. So, and you're trying to find something that's 10 years old. So I think, the changing, and I think Brady made this point, when you get into, and I segment our 65 to 108-year-old, members that we have, the 65 to 75 do behave differently than the 75 to 85, who do behave differently than the 85 to 100, right? But today's 40-year-old in 15, 20 years is going to be tomorrow's 65-year-old, and they're going to be digitally native in the sense that they've been working with computers their whole life in their jobs, and then they retire. What is their likelihood to consume, a digital experience or virtual experience? I think it's going to be significantly higher. The one big, I think, point, I made this earlier, but I still think it's so important, is that it can't be a one-size-fits-all. You've got to create the capacity for people to engage with it, like on their terms. So I'll give you one quick example. We have a member of ours who will work out at home on one of our not live national training events. We have proprietary ways to help seniors work out the right way. She'll do that on Mondays because she has her kids who come by and visit with her in the afternoon. So she doesn't have time to go to the Y or go to Lifetime, work out, come back, shower, do all that. So what she does, she just does it at home. But on Wednesdays, her and her team are going to go to the gym, and then afterwards they're all going to go get coffee. And there's a real social community aspect to this. And that's the one kind of potential, constraint that we have between the two.
But is that a constraint or is that an opportunity?
I still think it's synergistic, right? I'm constrained in the sense of which one's going to be larger. I think it depends on the individual. And that's the point, right? Which is maybe I lean a lot more digital this way, and I'd rather do everything that way, and I don't want to talk to anybody. And other people are like, I'd rather be much more, live and together, and then every once in a while, and there'll be people in between. So I think it's just a point that we make it available to everybody, but on their terms. It can't be my way. And Brad made this comment, well, I've done this before in a past life, created an app, and all you have to do is go to the App Store and download it and use it every day. And people are like, yeah, I'm not going to do that.
Not gonna happen.
That's not how I live my life.
Kate, you got a fascinating population that you manage. Your thoughts on that?
Yeah, I mean, I think it's really exciting to bring a lot of the women's and family health issues to the fore. This concept of the consumerization of healthcare and demand side, demand driven utilization and basically values, right, in the healthcare system. Women control 80% of healthcare decision making. That was one of the original disconnects. Certainly when I started Maven, is how is that the case, and yet women's health is so fundamentally underserved. And so, I think it's really exciting. And there's, as we shift to that, there is going to be, the way it's kind of funny. I've been reflecting, we're talking about digital, in healthcare. But actually a lot of other technology companies are talking about virtual reality, the metaverse, augmented reality, non-fungible tokens. And so healthcare is still a little bit behind, even in this whole concept of how do we leverage digital? So we got to move a little bit faster here, not too fast, because of course this is our health, but there's just so much going on in technology right now that can truly personalize these experiences and create a more demand-driven system that fundamentally is lower cost, higher value, all the things that we all talk about. So I think it's exciting, but I do think we still there's still a lot of tension in the system, misaligned incentives that we have to work through to move a little bit faster.
So Brad, let me start with you. 15-second round robin. We'll wrap up. What are you excited about? Let me ask it differently. How will you know that we're succeeding in this hybrid digital hopefully revolution, not just evolution.
I think when you see patient populations who you wouldn't think would be the first ones to embrace digital start to embrace it on a recurring basis, that's really, one sign we're starting to reach a tipping point.
Yeah, great observation. Richard, we'll say the last one.
I think it's less financial and it's more, the customer metrics. So I think at a point in time where we're seeing rising engagement across all populations into this kind of, hybrid approach, I think that's how we know we've got a momentum that's going to carry us into the future.
Awesome. Kate?
+1 to all of that. I know I'm looking at this clock right now. So, but yeah, no, really, I think we're at the point that Brad said, we're at a tipping point, and it's a really exciting place to be.
Awesome. Well, let me thank all of you. This has been fantastic. I've learned a ton listening to you. It's been a real pleasure to spend the last 40 minutes with you. And thank you for joining us. And to everyone out there, thank you as well.